I also sit on the Homelessness Roundtable in Port Lincoln, so really appreciate the opportunity to be here today and hear you talk. Early on in your presentation, Andrew, you had a slide, and I think from memory it was 45 people per 10,000 are classified as homeless across Australia, and 38 per 10,000 in South Australia. So South Australia, you know, has a better figure than those nationally. I'm just wondering what's happened to those figures over the last particularly 13 years that you've been talking about. Have they moved up, down, or remained static?
Thank you, Peter. See if this is on. No, it isn't. Okay.
I might answer from here if you don't mind, because the microphone doesn't seem to be on over there. What I think you'll find is we've had gradual increase in the number of the homeless people in Australia over the past 15 years, and the rate per 10,000 population has been relatively static because we have both a slight increase in numbers but also an increase in population over the same time. So it's been relatively static for the population as a whole. The rate in South Australia has drifted up very, very slightly. I should point out that the presentation I gave today actually has a written paper, and that paper is available from the Don Dunstan Foundation website if anyone wants to download it. So I should note that.
Thanks, Peter. I'm sorry I didn't know you were here, or we would have acknowledged you formally.
Late registration.
Welcome.
If you happen to come from the pre-dinosaur area and can't download it, could you get a copy of your speech today here?
Sharon, can you print? Yep. Sharon will print one later. Further questions?
Hello, I'm Alice Clark from Shelter SA. Thank you, Andrew, for your informative talk. The figures you mentioned about children under 9 years of age, it's a big concern for all of us, is child protection and looking after our children. Do you have any views on a whole-of-government approach to this issue rather than just the homelessness sector?
Thanks, Alice. Not really, because I haven't really thought through that issue. I know, talking with homelessness services, it is something that concerns them greatly. They're aware that the current sector the current system for protecting children does have considerable room for improvement. It's a point of frustration for them that often they see their own resources being devoted, trying to make reports and perhaps not getting the outcomes that they're looking for. It's clearly a priority for the state at this stage, and something needs to be done. I haven't yet thought through what that is, and I'm not particularly sure I'm best equipped to do it, but I certainly agree it's a priority. And I guess the other thing I'd say is that if we can improve the child protection system, we can actually improve the homelessness system as well, and I think that's the key relationship. Homelessness often, as many people point out, is the point of last resort in terms of services. If people fail in mental health, if they fail in child support, they often end up homeless, and it's those services that pick them up. So preventing homelessness is also an issue of preventing children at risk, is also an issue of preventing mentally ill people becoming vulnerable.